The optimal functioning of the various systems of the body depends on various factors, one of which is a steady supply of the necessary nutrients from our diets. These nutrients contained in our food must be absorbed through the walls of the gut into our bodies. However, there can be many challenges to this vital process, preventing the absorption of nutrients through the digestive system. This is generally known as malabsorption, and it can have dire consequences as the lack of nutrients wreaks havoc within the various systems of the body. So we've invited Dr. Paulo into the studio to discuss an alternative route of supplementation for individuals experiencing absorption challenges. Dr. Paulo, malabsorption, it's pretty explanatory, but tell us what the impact of it is and what it actually is and its meaning in the body.
All right, so for the purposes of our conversation, malabsorption covers all the challenges that relate to digestion and the absorption of nutrients.
Okay.
Ineffective digestion and ineffective absorption. The causes can be chronic causes, so they can include diseases such as celiac disease, chronic pancreatitis, Crohn's disease, ulcerative colitis, people that have undergone gastric surgery, for example, and alcoholics or alcoholism is also an issue. There are acute causes as well for malabsorption. If we look at the environment of the gut, the presence of parasites, the fact that the microbiome, the friendly bacteria, are not what they should be, usually because of antibiotics, all right? H. pylori infections that cause ulcers, okay? The inflammatory processes within the gut as well, damage to the barrier, the function of the barrier layer of the gut, okay? So all of these are possible causes. Diets, or rather defective diets. There are people who don't eat any fat, for example, or very high sugar, vitamin deficiencies as well, and of course, changes in the levels of enzymes, digestive enzymes, and intrinsic factor, acid in the stomach, and so on. So all of these can play a role in causing malabsorption.
Okay. So Paulo, it's not something that you're going to immediately know that you have. What are the signs and symptoms that might indicate a malabsorption case?
That's a difficult question because the signs are not what we call non-specific.
Okay.
So if you feel bloated, it doesn't mean necessarily that you have malabsorption. However, bloating is one of the possible symptoms of malabsorption. So it depends on how long the challenge has been present. It depends on the severity of the challenge, on what is actually not being absorbed. Then we have two sets of symptoms. We have symptoms within the digestive system, such as bloating, such as chronic or regular diarrhea, and we have symptoms that are systemic. So you start losing weight, for example.
Right.
Okay. Or one of the systems in the body, because of a specific deficiency, say in vitamin B12, for example, the formation of red blood cells will start suffering.
Okay. Now, Dr. Paulo, apart from dietary, as you've mentioned, these absorption challenges also affect the way we absorb any sort of vitamin or nutrient supplements that we're taking. And over the past year, or a couple of years, there's been quite an increase in ranges of vitamin sprays or supplementation sprays, which are taken through the mouth. Why is it that there's absorption through the mouth would be better than through our digestive tract?
Well, initially, they didn't know if it would be better or not, but the absorption is done, so the lining of your mouth on the sides, and especially the lining under the tongue, is very rich in blood vessels.
Okay.
And so the absorption is done through the lining into the blood vessels by what we call passive diffusion. So it just goes from one side to the other without any requirement for special carriers, like you have in the gut, for example, for some of the nutrients.
Okay. Now, Dr. Paulo, all things are not created equal, as we so well know. Which of the vitamins or nutrients are most affected by malabsorption challenges?
Okay, so that's also a very long answer, but let's look at some fat-soluble vitamins, such as vitamin D3 and K2, for example. See, those vitamins are normally absorbed through the lining of the intestine after having been combined with bile acids.
Okay.
So when you take a tablet, it goes into your stomach, through the intestine, gets combined with bile acids, and then it can be absorbed. So there are many conditions or situations that can affect the system. For example, just normal aging, obesity plays a role there as well. The reduction of lipase, which is the enzyme that digests fat, changes in pH, and of course, if there isn't enough bile acid available. Okay. Then in terms of, an example of a water-soluble vitamin would be vitamin B12. So vitamin B12 needs intrinsic factor, which is manufactured by the cells of the stomach, which joins to B12. It then takes it to the end of the small intestine just before the colon, and it requires calcium and an alkaline pH in order to be absorbed.
Okay, so it's got a lot of things.
So you can see there are many factors. So anything such as gastritis, H. pylori infections in the presence of ulcers, patients or people that take proton pump inhibitors, the drugs given for ulcers to reduce stomach acid, for example. Anyone on metformin, which is a standard drug for diabetes type 2. Okay, so all of those people will have problems absorbing B12, for example.
Right. So, Paulo, is there evidence that these kind of vitamins are better absorbed through the mouth than through oral digestion and processes?
Yes, definitely. There are many human clinical trials. For example, for vitamin D3, the trials show that what is known as a buccal spray, buccal meaning mouth, allows you to absorb 3 to 10 times more.
As much as that?
As much as that. They've measured the content of D3 in the blood of both healthy participants as well as patients with malabsorption syndrome, and they found that the levels have increased more than with oral capsule. Okay. In terms of K2, for example, we know that the absorption of K2, whether it is from food or from a capsule type of supplement, is only 5 to 15%, whereas with a spray, it is much more efficient. The percentage varies, but it's highly, highly efficient. And then with B12, the onset of action is much faster.
Right.
So basically, it gets to do the job much quicker than if you take it otherwise.
Yeah. So, Paulo, I mean, is there a case to say that if you have the choice, an oral spray would most likely be a more effective choice to make over a capsule? I mean, obviously, we need to factor in things like the quality of the source and where it's coming from.
Yes.
But as a fairly standard, if you're looking at quality supplements, would a spray invariably be somewhat of a better option?
Yes. All right. So when we started, you said that you mentioned the group of people that have absorption problems. So obviously sprays should then be used by all of these people, okay? If they are available, obviously.
Yes.
Okay? And with someone who does not have absorption problems necessarily, they can also be used because they are more effective, generally speaking.
Okay.
All right? One has to know, of course, in terms of dosage. You'll see when you see sprays, it'll tell you that 4 sprays give you so many micrograms of this, for example. So that's how you measure, whereas in a capsule, you usually know that a capsule contains a certain amount.
Yes, okay. So, Paulo, we have put into our Real Health Medicine cabinet this week products from Phytoceutics, and these are the 3 that you mentioned, the vitamin B12, vitamin D3 and K2 oral sprays. They are the Phytomist range as we know them. Tell us a little bit about these. I mean, where do they come from and what makes them a fairly good choice?
Well, this range of products is done with the latest technology in terms of incorporating the vitamins in this case. You said it's D3, K2, yeah. In terms of incorporating the vitamins into the spray in a manner that will facilitate the absorption through the lining of the mouth. And under the tongue, sublingual.
Right. And is it suitable for everybody to use? I mean, these kind of products, as we mentioned, if you've got a disorder, absolutely. Are there, though, people who should be cautious of using products like this?
Well, it depends on what is in the product. If your question is about a spray, there's nobody that should not use a spray, depending on what is in the spray. So in terms of this range that we have here now, all these vitamins can be used by anybody. There's nobody that should not be using them. The only thing to note would be that a child, for example, may not take 4 sprays or 6 sprays, whatever the recommended dosage is, but I assume that they will have dosages for children. Okay,
so follow the instructions, know what you're doing, know what you're using, and you'll be on the right track. Paulo, where can we find these products?
I believe they're available in health shops and pharmacies.
Okay, great. Thank you so much, as always. Great insights.
Pleasure.